Welcome to the topic Drugs for Emotional, Behavioral, and Mood Disorders. First, talk about the situational causes of depression, like unpleasant life circumstances. It can be a grief about a lost loved one, divorce, loss, or a dissatisfaction with the job, financial difficulty, excessive stress or responsibility, negative thinking patterns, an environment that is likely to cause an individual to feel as if any attempts to escape or correct a situation are hopeless, poor self-image, or the lack of support from the family or friends, substance abuse, the substances that produce the unpleasant adverse effects or the withdrawal symptoms such as opiates, alcohols, or other central nervous system depressants. Medication intended for therapeutic use can also be one of the situational cause of depression, which causes unfavorable adverse effects from medications intended to treat a medical disorder, for example, some antihypertensive drugs and the oral contraceptives. There are also some biological or physiological causes of depression, which includes genetics, the history of depression in one's family, hormonal changes in the body, like fluctuations of the reproductive or metabolic hormones, neurobiological dysfunction, which includes chemical disturbances in the brain, usually related to abnormal functioning or release of neurotransmitters, for example, dopamine, norepinephrine, serotonin, or melatonin. Also, a cause can be a symptom from a second disorder, which is almost any debilitating disorders like head trauma, dementia, brain stroke, or tumors, chronic pain, or thyroid dysfunctions. So the most common types of the depressions include the severe depression, which is intense and overwhelming feeling of sadness and hopelessness. Severe depression with psychotic symptoms, the symptoms of severe depression as well as the psychotic episodes, and the mild depression and moderate depression. Dysthymia, which is a chronic depression that can endure for years at a time. And bipolar depression, extreme mood swings ranging from energetic highs to the lows of depression, and recurrent depressive disorder, which is the repeated episodes of depression that come and go over a period of time. Now, clinical features of major depressive disorder and dysthymic disorder. If it's a major depressive disorder, then 5 or more of the following, at least one of which must be depressed mood or diminished interest or pleasure on most days for at least 2 weeks. This is the main diagnosis that a person is having a major depressive disorder, like depressed mood, diminished interest or pleasure, significant weight loss or weight gain in the last 2 weeks, insomnia or hypersomnia, psychomotor agitation or retardation, fatigue or loss of energy, feelings of worthlessness or excessive guilt, diminished ability to think or concentrate or indecisiveness, recurrent thoughts of death, suicide, or suicidal attempts. And if a person has to be diagnosed with the dysthymic disorder, then we have to see for the depressed mood for the most of the day, more days than not, for at least 2 years, plus at least 2 of the following should a person have it: poor appetite or overeating, insomnia or hypersomnia, low energy or fatigue, low self-esteem, poor concentration or difficulty making decisions, feelings of hopelessness. But the treatment of the severe depression requires both medications as well as the psychotherapy for the best results. So diagnosis includes the complete health exam, must rule out the medical causes first, and then we use the drugs for them like glucocorticoids, levodopa, and oral contraceptives. We can also find out medical and neurological disorders in a person, and we can give them vitamin B deficiency drugs, thyroid gland problem drugs, and the early Alzheimer's disease. This can happen with a person with having the depression. Also, psychological evaluation is performed by the psychiatrist or the psychologist to confirm the diagnosis. When we do the assessment, we check the alcohol and the drug use, thoughts about the death or the suicide of the person, what is the family history, and if it is treated, what therapies they received and which of them were effective for them. Now, the major depressive disorders, it must show at least 5 of the following symptoms: difficulty sleeping or sleeping too much, extreme fatigue without energy, abnormal eating patterns, eating too much or not enough, vague physical symptoms like GI pain, joint muscle pain, or headaches. Symptoms includes inability to concentrate or make the decisions, feelings of despair, lack of self-worth, guiltiness, and misery all the time, obsession with the death, a wish to die or to commit the suicide, avoidance of psychosocial and interpersonal interactions, lack of interest in personal appearance or sexual pleasure, delusions or hallucinations. But the treatment also includes combination of medication and psychotherapy to achieve the best responses. We need the counseling therapies, behavioral therapies, short-term psychotherapies, and interpersonal cognitive behavioral or interoconvulsive therapy, which is ECT, which has been the traditional treatment for this disease. Now, antidepressants, they enhance the mood by boosting the actions of neurotransmitters. Which neurotransmitters? Norepinephrine and serotonin. Antidepressants, they combat the depression, they enhance the mood, boost the action of neurotransmitters like norepinephrine and serotonin. So antidepressants, actually the exact cause is unknown for that. It leads to the depressive disorder, which can be a persistent sadness and loss of interest in anything. But some evidence suggests that there are the monoamines, they are decreased in the body, like serotonin levels are decreased, norepinephrine is decreased, and dopamine is decreased. And there are two main classes of the drugs in pharmacological treatment, main that we use for tricyclic antidepressants and monoamine oxidase inhibitors. But we do have other drugs as well. Like the classes of antidepressants are the tricyclic antidepressants, selective serotonin reuptake inhibitors, SSRIs, serotonin norepinephrine reuptake inhibitors, SNRIs, monoamine oxidase inhibitors, MAOIs, and atypical antidepressants. So these are the main 5 classes of the antidepressants that we will be studying in the next video. Thank you.